Medical Billers Day is March 28th, 2024, which is tomorrow, and that is why you are getting this special 4-part series about the 4 basics of medical billing. This is part 3, so if you haven't checked out part 1 and part 2, please make sure that you do. But in part 3, we're going to be talking about denials and the aging report. And I also wanted you to check out my shirt. It says, I'm a medical biller, because I am a proud medical biller and you should be too. So make sure you check out my shop where you can get your shirt as well. But today, we're going to be talking about denials and the aging report, so keep watching. So in my opinion, this is really where the heavy lifting starts, with denials and with the aging report. So if you're a medical biller and you don't agree with me, just leave that below and let us have a conversation. But when you send out claims, that may be easy. When you post payments, that may be easy. But when it comes to denials and actually getting the claims paid, remembering to follow up on these claims, then that is where I think the heavy lifting really starts. Claim denials is when the payer feels that the financial responsibility is not theirs, that it's either the patient's or the provider's. So why are claims denied? Claims can be denied for several different reasons, but you can usually find out the reason behind that in 2 ways. On the remittance advice through the CARC, which is the Claim Adjustment Reason Code, and the RARC, which is the Remittance Advice Remark Code. These codes help you determine the reason that your claim was not paid and the reason it was denied. Now, let me give you a little secret. It's supposed to tell you this information, but there can be times when these reason codes are really unclear. Like maybe they are vague, or it just doesn't make sense to the claim that you needed processed. So sometimes you have to dig deeper and further and call the payer to give you a real explanation of why your claim was denied. Some denial examples could be a duplicate claim, it can be no coverage, it can be no prior authorization, it can be not medically necessary, or it can be that it's bundled. Again, that's just 5 of them, but there can be several reasons why your claims are denied. Now, I've done a video talking about the reasons why, or some of the reasons why, because like I said, there are many reasons why a claim could be denied, but some of the reasons why, some of the most common reasons why your claim is denied, so check that out. There's a part 1 and a part 2, so check out that and it can help you with some of the reasons why your claims are being denied. So of course, I can't tell you step by step what exactly to do when you have a denied claim, because I can't possibly figure out why your claim is denied. But here are 3 tips that I can give you when you are trying to figure out why your claim is denied and what to do when that happens. And the first one is to identify the denial reason, and that's either by looking on the remittance advice or actually calling the payer. Like I said, sometimes the remittance advice does not tell you everything. It is the fastest way of finding out why your claim has been denied, but sometimes you have to go a little bit further and speak to the actual payer. And the second way is to determine if the denial is correct. Review the reason and then decide what your next move is. Sometimes your claim can be denied and they can say that your provider is not in network, but if your provider is actually in network, then it should not be denied. So you need to make sure that the denial is correct, and then you'll be able to move on from there in determining how you are going to figure out what to do. It is a case-by-case basis. So even if I get a denied claim that says that my payer is not in network, and you get a denied claim that says that your payer is not in network, we might have to take different steps to get that claim corrected. It might not be the same thing that we have to do. So that's why I can't sit there and tell you what exactly to do. I can just try to give you an idea of what you should do, but you're going to have to figure out exactly what you have to do. And for each payer, it may be different as well. And then you're going to perform the next appropriate step. Now, that next appropriate step may be to make the changes and resubmit. It might be to forward the responsibility to the patient. It might be just to make adjustments in the system. Or you might need to make an appeal to the payer to have them reevaluate the claim and make another decision. So here are some tips on efficient denial management. You first want to establish a workflow. Unlike rejections, denials can be a lot harder to clear up or to deal with. So you want to make sure you have a workflow of how you're going to deal with it each and every day or each and every week. Also, you might get one denial, but you're not going to have that one denial alone. You most likely will have several denials. So you're going to want to have to figure out how you're going to put that in your workflow. Also, I would recommend creating a log for these denials. So you want to know who's the payer, what's the reason for the denial, and what solution you came up with. Now, if you have a payer, let's say Cigna, and you got a denial for a specific CPT code, and the way you corrected it was by putting a modifier, you might have another payer that denied that same code, but you can't put a modifier on it. So you're going to want to write this log or create this log with the different payers' information, like I said, what the reason is, and your solution, because your solution may be different from one payer to the next. It may also be different from one policy to the next. So you just really need to create maybe even an Excel sheet so that you can see how you dealt with it, so you don't have to waste as much time the next time you see this same denial. And most important, I would say to make sure that you educate yourself, your provider, the coders, the front desk, whoever is involved with these denials, because instead of having them continue to make these errors over and over again, if you educate them, then you can make sure that these denials are decreased and that you have clean claims the first time and you don't have to deal with these denials on the back end. Now, I'm sure you have heard about agent reports. And agent reports are a list of the claims that have not been paid and how long they have not been paid. That's the basics of what an agent report is. It doesn't tell you why they weren't paid, but that is for you to figure out in the long run. So the agent report is basically the accounts receivable. And if you don't know what account receivable is, then I will link that video above that I did. But you would have to deal with, as a medical biller, the agent reports for your provider or for your providers or for the complete practice. So you're going to want to know how to deal with that, which ones to do first. It would also include timely filing, because you want to make sure that you get the claim in as fast as you can. On the agent reports, most of the time should only have denials basically on your agent reports. But depending on how you deal with the other parts of the billing, such as your rejections and your claim submission, you may also have on rejections and claims that have never been submitted at all. But it should mainly, or the bulk of it, should have on the claims that were denied and not paid and are probably being worked on the back end. It's just that they're still outstanding. So be sure to come back for part 4 and check out part 1 and 2 of our 4-part series on the basics of medical billing. I'll see you in my next one.